evening to everyone and welcome to today's wonderful presentation of the quiz. I hope you all got the quiz link. If you did not get the link, please look into the chat window. There is a quiz link which is available. On your smartphone, you need to go to the quiz link and start punching your answers. So we have with us Dr. Vikram. Vikram, you are from which medical college, doctor? A quick intro. Hi, Vikram. Are you there? You are from which medical college? Yeah.
Hi, sir. I am from Nalanda Medical College, sir.
Very good. Nalanda Medical College is, where is it located, doctor?
In Patna, Bihar.
Wonderful. In Patna, Bihar. And we have a lot of other students who also joined directly using the link. And if you like to join directly into the broadcast, please don't forget every day you can ask our helpline to get the link for the joining into the live broadcast. The winner of everyday's quiz gets 500 rupees, more than the cash prize, the spirit of fighting, the spirit of joining, and the spirit of winning. That is what we all need to look for. So with that, let's make the great beginning, doctor. Yes. So, very good. We have almost 18 players who are part of this battle. Dharma Kshetre, Kurukshetre. So, basically the whole idea is reading is boring. Somebody teaching us is more boring. But what is really challenging, interesting, and enjoyable is a fight. Fight, fight, fight. So let's make the beginning, doctor. Please share the link. You're able to see this link, right? ahaslides.com/F9EAZ. I already typed that into the chat window. Please share it with your friends. Chalo, shuru karenge, tam bola. So today's quiz, we have around 41 questions. A 27-year-old lady with 20 weeks pregnancy presented with a thyroid nodule on the right side. The FNAC of the nodule is suggestive of papillary carcinoma. Then what is contraindicated in her management? Punch your answer, doctor. Very good. 4 of you rightly answered. That is radioactive iodine ablation. But otherwise, total thyroidectomy plus neck node dissection, right lobectomy, total thyroidectomy, all of them are very much indicated because of her age. Above the age of 40, it is radioiodine. Below the age of 40, always the surgery. That is a very important dictum that need to be remembered. Very good. SP is on the top. SP was the yesterday's cash prize winner. Let us see who is going to beat SP. Akhilesh is also right. Akarsh, Vishnu Soni is also right. Absolutely, doctor. Now, the next question. Question number 2. This is a thyroid scan. What is the most probable diagnosis? Looking at the scan, what is it most likely possible diagnosis? Is it a diffuse uptake? Then it would have been Graves' disease. But it was not a diffuse uptake. It was a localized uptake. That's the reason it is a hypersecreting adenoma, which typically lead to the surrounding tissue become suppressed from radioactivity is what you need to emphatically remember. That's good. SP is on the top, followed by Akhilesh, Gayatri, Anil Kumar. Excellent, doctor. Now, question number 3. Question number 3. A young lady presented with young lady presented with midline neck swelling, which is being shown to you. Yes. Which moves with deglutition and swallowing. Very good. That's a very easy question. Thyroglossal cyst, the classical history you should be able to identify. Very good. SP, Akhilesh, Akarsh, Anil. All A's are doing really great. In fact, it is answered by a lot of you correctly. Very good, doctor. Question number 4. What is the sensitivity of the axillary ultrasound in identifying the axillary metastasis in a clinically node-negative carcinoma breast? Is a very important question. Beautiful question. Beautiful means it's a stupid question in the entrance exam. Unless you are super duper good and lucky with the numbers, it is very difficult to answer this question. But still, I'm giving you this question to tell you, doctor, that there are some stupid questions like this in the real exam, but you need to have the courage to bypass them or pass them while you are preparing for while you are taking the real exam. That's good. So, doctor, the next question. Question number 5. A 45-year-old female presented with the history of a painless breast lump, which has a size of 6 into 5 centimeters in the left upper quadrant, no axillary lymph nodes. So what is your treatment in this given case? Wow, only 3 of you are right, saying adjuvant radiotherapy. Absolutely. Once more, Akhilesh, Gayatri, really good. Excellent, doctor. Even Arvind also. Wonderful. Now the question number 6. A 56-year-old patient comes to casualty with a history of massive hemoptysis. Chest X-ray was normal. So what are the various things that you do to prevent hemoptysis? Is a very important question. Very good. So you do bronchial artery embolization, pulmonary artery embolization, bronchoscopic laser cauterization. They're all the options which are available. Absolutely, doctor. So Faiz Fatima, wonderful, really a very big leap. Faiz Fatima looks like today going to become take away the prize. Very fast growth. Now, question number 7. A woman was brought to casualty 8 hours after sustaining burns on the abdomen. And what is the best formula to calculate the fluid to be replenished is a very important question. Right? Very easy question. Yay! 9 were all misled by option 4. 4 ml per kg into percentage total body surface area. That is considered to be the most recent recommendation. Good. So Akhilesh and Gayatri, Faiz Fatima missed the bus. Question number 8. Question number 8. In the patient, as shown below, the chest wall closure has been achieved. What was the flap that was used to close this chest wall gap? What is your guess? So, doctor, very good. 8 of you are right. Pectoralis major myocutaneous flap. So there are totally 80 high-yield topics in surgery. You should emphatically remember, there are 80 topics in surgery. Please download the Incus app. There are 2000 HD videos, totally around 800 hours duration, which is available for you. In that, if you have done some of the topics and questions wrong in today's quiz, the best way is to go back to the Incus app and do the revision. Also, there are 35,000 slides, 60 full-scale grand tests with discussion, and daily live online class, thousands of 3-minute videos for you to do revision, everything for a small price of 999 rupees for 3 years access. Nobody in the world gives you so cheap. Only 1 rupee is the cost and investment of you for the PG medical entrance preparation. And above all, there are a lot of NEET PG toppers who are available to discuss the strategy with you in the Incus app. There are a lot of NEET PG toppers and a lot of faculty who are ready to share regular live online interactive sessions with you. So today only download the Incus app and then subscribe for 999 rupees. If you want to get the subscription, please call our helpline. So, Doctor, continuing our journey into the questions. So, even the online students, if you joined a little late, you can still join the quiz. Now, Doctor, you have on the top, you have the link to play the quiz. So, Gayatri, SP, Faiz, Fatima, absolutely right. Question number 9. A 1.5-year-old child was brought to emergency with a history of the burns with hot water on both the hands and palms. So, what is the best management of this patient? The lesion was pink, oozing, and painful. So that itself will tell what is the degree of the lesion. Absolutely, paraffin gauze with dressing is considered to be the best way to manage this. Oozing wound is what you need to remember. Very good. Faiz Fatima, I'm very sure is today going to give a big bet to many people. Sankit Kenja is yesterday's quiz. He's almost about to become winner, but last 10 questions changed a lot of things in yesterday's quiz. Now, question number 10. Question number 10. All the following are true about the primary survey of a trauma patient. Trauma patient. What is your answer, doctor? Punch your answers. In case of a trauma patient, primary survey. Very good. Cervical X-ray is not mandatory. Chest X-ray and pelvic X-ray are part of the primary survey. Hemodynamically unstable patients should not present for CT scan. That's what you need to basically remember. So, doctor, that brings Akhilesh, but Faiz Fatima clean bold. WHO is going up. Good, doctor, good. Question number 11. A patient met with road traffic accident, paralysis of the both upper and lower limb. He has not passed the urine and tenderness elicited in the cervical area. What will you advise to this patient is a very, very important question in surgery. Very good. The patient should not be shifted. Is very important thing that you need to remember in view of the complexity. Good. Akhilesh and SP are both right. So today Akhilesh is giving a very good competition to SP. A patient of motor vehicle accident was admitted to casualty. He does not speak but moans. Ooh, ouch. Every now and then, eyes are closed but opens to pain. You should know how to calculate the Glasgow Coma Scale instantly. Very good. The score is 9. 8 of you correctly answered. Very good, doctor. So exam is all about reflexes. Not any much of thinking. फट आंसर करना है. उसके लिए आपको प्रैक्टिस होना है. उसके लिए आप डॉक्टर मुरली भरद्वाज के साथ रोज शाम को क्विज खेलना है, एक्टिव बन जाना है, और Incus ऐप में जाना है और वहां के वीडियो लाइब्रेरी में रिवीजन करना है और 953 टॉपिक्स को अपने मुट्ठी में लेना है. That is very, very important. Now, doctor, question number 13. A young boy presented to the casualty with a fever, pain, and vomiting. On examination, he was febrile. Pulse rate was 104. What is the sign elicited by the resident, which is being shown to you in the picture? Easy question. Very easy question. McBurney's point tenderness is what you need to basically remember. A lot of people ask a question. Sir, are the image-based questions really complex, complicated, difficult to answer? No. Because common things, Davidson, Harrison, Robbins pathology, surgery, clinical methods by Das, and Datta's instruments, they are the ones which are being picked up by the examiners. So really not difficult and complicated. Good. Akhilesh and Faiz Fatima, very closely having a boxing show. Let us see who is going to be the winner and win 500 rupees cash prize every day. A patient underwent laparoscopic cholecystectomy, was discharged on the same day. On post-operative day 3, he presented with hospital with fever, 5 to 5 subdiaphragmatic collection. What do you want to do in this given clinical scenario? So typically post-operatively after laparoscopic cholecystectomy, we put a pigtail insertion and try to drain. So that is what we typically do. So I think most of you should be right, but SP Faiz Fatima could be able to make it. Lahari and Gayatri are also in a very promising point to become the winner. Now, question number 15. Chrysal's lines क्या होता है? What are Chrysal's lines? So there are a lot of natural embryonic growth made, the way the things mix up, right? So they are the greatest tension lines in the skin is what you need to remember. So doctor, many of you are clean bowled. Now, question number 16. A middle-aged female presented with recurrent bloody diarrhea. Colonoscopy show multiple geographic ulcers and histopathological examination is being shown in the picture. What is your diagnosis looking at the picture? Recurrent bloody diarrhea. Classical clinical story. Yes. I am betting you, doctor. Of course, multiple geographic ulcers is a very important clue. Without a question on Crohn's disease or ulcerative colitis, अगर नीट पीजी एग्जाम और INI CET है तो मैं नाम बदलूंगा. सो इतना शूट शॉर्ट टॉपिक है. अगर रॉन्ग करे तो आज ही आप इनकस ऐप में जाके 999 रुपीस के पैकेज लेके 3 साल का एक्टिवेशन मिल जाएगा. ओनली 1 रुपी इज द कॉस्ट ऑफ प्रिपरेशन फॉर नीट पीजी per day. 999 rupees, 3 years subscription. Every Sunday there is a full-scale grant test of 200 questions and discussion. And every day evening there are live sessions. And above all, there is already 800 hours of video content of around 2000 HD videos, PowerPoint slides, notes, everything available on the Incus app just for 999 rupees for 3 years of activation. So, doctor, very good. Akhilesh, Indrajit are absolutely right. Oh, question number 17. Maximum risk of carcinoma pancreas. कहाँ होता है? Out of all the lesions shown to you, maximum बोले तो 100% chance. I think most of you will correctly answer. वो Peutz-Jeghers syndrome में carcinoma pancreas. 3 of you answered familial edematous polyposis, but familial edematous polyposis is more to do with the colonic carcinoma, is what you need to basically remember. Very good. Faiz Fatima is batting like anything. Very good. Question number 18. A 55-year-old patient with dysphagia. Identify the diagnosis from the upper GI biopsy of the esophagus, which is being shown to you. Dysphagia, 55-year-old upper GI biopsy. Wow. What else it can be? It is the Barrett's esophagus, which is a metaplastic epithelium. Very good. SP could cross Faiz Fatima because of rightly answering this question. But beware of Lahari, lock your doors. Lahari is on a rampage to become the topper. Very good. Let us see. Question number 19. 19. A person met with road traffic accident comes to casualty with a contusion in the anterior chest wall. The pulse rate was 90, BP was 120/80. Normal heart sounds, but the breath sounds were decreased on the left side. Wow. Classical question. Classical question. Absolutely. It is an indication for placing an intercostal drainage tube when you have the tension due to thorax, is what you need to remember. Very good. Good to see 28 online players, and I want these 28 players to become 2,800 concurrently playing players and win a bigger cash prize every day. That's good. Akhilesh is on the top. Question number 20. A middle-aged male presents with fever, diarrhea, 1 week, acute onset pain, abdomen for 6 hours. A erect abdominal X-ray. Please look into your smartphone. What is the most likely diagnosis? Fever, diarrhea. That is the important clue. It is a toxic megacolon associated with ulcerative colitis as a complication, is what you need to remember. So, doctor, NEET PG exam एक जमाने में single liner exam था. आजकल तो case study based है, and it is very easy to crack case study based, clinical vignette based, USMLE style exams, because what you require is common sense that should be carried to the exam. So, question number 21. What is the best approach to reverse the effects of dabigatran? Dabigatran ka, so you should know the various direct thrombin inhibitors, and you should also know what is their mechanism, which of them are oral, which are not oral and intravenously given. So all these things you should know when it comes to direct thrombin inhibitors. Hemodialysis is the only way. Only 4 of you correctly answered for the dabigatran. So since you have done this wrong, those who have done this wrong, please go back to the Incus Act and then go to pharmacology. हमने pharmacology में गर्मा-गर्म discussion कर चुके about all these direct thrombin inhibitors. So, doctor, all of you are almost uniformly clean board. Vishnu Soni, Vikram Thakur, our Shri, absolutely right. MS also correctly answered. Very good, doctor. Question number 22. The new oral anticoagulants which are available today, in fact, you need to look into your smartphone. So different clinical cases have been given. Who is the right person? Absolutely. It is a 73-year-old man with mild renal insufficiency, in whom it is indicated. Now, that's good. Most of you have gone wrong, but don't get disheartened. So, doctor, a 62-year-old with history of hypertension presenting with hematochezia during the first 24 hours in the hospital, he has 2 more small maroon-colored stools. So, what is your diagnosis and how do you want to treat? So, in this case, patient is hemodynamically stable, and GI bleeding is not life-threatening, and that is the reason observation is the best choice in this given clinical case scenario. So that's good, doctor. Most of you got clean bowls, and yeah. Now the next question, question number 24. Painless hematochezia. Painless hematochezia, which is associated with painless hematochezia. Yes, doctor. Remaining are all painful. Very good. 7 of you are right. A aortoenteric fistula 3 years following abdominal aortic aneurysm repair is considered to be painless. Absolutely, doctor. Very good. Akhilesh is on the top with 1002 points. SP, Lahari, Faiz, Fatima. Close fight is happening. Let us see. Oh my God, Lahari is progressing very fast. Question number 25. A 79-year-old woman presents to the emergency with abdominal pain, passage of bloody stools, and her past history, hypertension, and diffuse tenderness on the left side of the abdomen, no evidence of peritonitis. What is the most appropriate next step? So first of all, what is the diagnosis in this given case? This is a possible clinical presentation of ischemic colitis leading to intestinal ischemia. It is very common in the people in the atherosclerotic age group. Above the age of 65 is what you need to remember, and colonoscopy would be the best choice in this given case. Oh my God, most of you have gone wrong. Now, doctor, you want to identify the site of the lower tract GI bleeding. Which investigation has best specificity? The word specificity is important. Be very sure, doctor. Best specificity. Wow. Only 2 are right. Let us see who are those 2 people who are right. Mesenteric angiography. Oh my God, the top guys are all gone. Let us see. Anju. Anju only is right. And Viplav Vishwas is also right. Absolutely. Now, question number 27. A 19-year-old woman presents with 2-day history of lower abdominal pain, no fever. She has tenderness in the tender left adnexal mass. Beautiful question, right? Tender adnexal mass. Pregnancy test was negative. Normal urine analysis. What is the most appropriate management? So you should be very sure in this given case, pelvic ultrasound would be the best choice. Diagnostic laparoscopy is not yet indicated because her current condition is not fully evaluated and there is no urgency. And CT is okay to rule out appendicitis, but considering her adnexal mass, tenderness, female patient, lower abdominal pain, all this is more towards gynecological pathology. So that is what you need to basically appreciate. So I'm really very happy to see 30 online players. Please inform your friends. Please subscribe to the YouTube channel, that is youtube.com/onlinembbs. Also put up the bell sign, click on the bell sign so that you keep getting notifications. And also inform your friends. By Rosh Sham, Chai Pe Charcha with Dr. Murali Bharadwaz, and the winner gets 500 rupees cash prize instantly. That's a good kick. Yeah. So let's see, doctor. Question number 28. A 26-year-old man complains of a colicky intermittent periumbilical and right lower quadrant pain of 24 hours duration. And his temperature is 36.6. What is the most likely diagnosis? Right lower quadrant pain. The most important thing, almost 18 of you are clean board. It is colicky nature of the pain. It is not compatible with acute appendicitis or chronic appendicitis or peptic ulcer disease or acute pancreatitis. Colicky है तो pain और intermittent pain जब होता है GI tract. So there should be either a mechanical obstruction or excessive peristaltic activity, which happens in the case of the gastroenteritis, is what you need to remember. Only one of you correctly answered this. Chalo, wo one kaun hai dekhenge. Oh, not the top guys. Not the, oh, Vishnu Soni. Is that one guy who rightly caught it for his colicky? That is an important clue. Now, question number 29. A 21-year-old woman had 1 day history of worsening lower abdominal pain, nausea, vomiting, low-grade fever. Her temperature is 101.3. She has a right head neck cell mass, cervical motion tenderness. Then how do you differentiate? Pelvic inflammatory disease, very common diagnosis. Mem saab gynecologist hai aur sarkar surgeon hai. Common combination in the matrimonial, drshadi.com. So I say situation में मेम साहब का केस है या सरकार का केस है. So this is how you need to differentiate. Always diagnostic laparoscopy can correctly pin down the diagnosis is what you need to remember. Akhilesh versus SP. Closely fighting. Faiz Fatima missed a few excess number of questions. So Indrajit, Lahari, SP, Akhilesh are in the fight. Let's see. Still 11 questions are there. Kuch bhi ho sakta. 47-year-old, 1 day history of right flank and right lower quadrant pain. History of nephrolithiasis. So, what is, yes. So, what is your answer, doctor? I think, yes. So, basically, kidney or ureteral stone or pyelonephritis is a possibility. CT scan without contrast in this patient can identify the stone, basically. So that is the whole funda. Very good. Vishnu Soni is quickly ascending up. Question number 31. A 32-year-old man who has right hip replacement surgery 4 days ago, small segmented pulmonary embolus. So, what is the study that is probably most helpful in diagnosis? Very good. Always in any given case of pulmonary embolism, you will prefer CT angiography. Very good. Akhilesh, SP, Faiz, Fatima. All of you are right. I'm surprised how Lahari can miss this question. Now, doctor, question number 32. 9 more questions. Out of all the clinical scenarios given to you, lowest pretest probability of having pulmonary embolism. Lowest probability of having pulmonary embolism किसको होता है सब जनों में? So, is an interesting question. Very good. A 21-year-old who had an uncomplicated laparoscopic appendectomy 3 days ago has the lowest probability. Whereas a 47-year-old who has got an ovarian cancer or a 26-year-old pregnancy with HELLP, pregnancy itself is a hypercoagulable condition, is what you need to remember. Very good. Akhilesh and Lahari and Vishnu, they're very closely fighting against. So question number 33. A 51-year-old man presents for an appointment for recurrent foul-smelling diabetic foot infection. There is no ischemia. 2-week course of vancomycin therapy. Yes, absolutely. 11 of you rightly answered. Piperacillin tazobactam is considered to be the best way to manage, is what you need to remember. Very good. Akhilesh, SP, Faiz Fatima. Let us see who is going to be the winner. Question number 34. So, please look into your mobile phone. You got a better image. A 54-year-old presents to the emergency with a 4-day history of abdominal distension, central colicky abdominal pain. Central colicky abdominal pain. So what is your answer, doctor? Small intestinal obstruction. So how do you differentiate small bowel from large bowel? That is the whole challenge of this question. Valvulae conniventis. The whole diameter of the gut, you find this radiologically, is an important differentiator. And the haustral folds are the feature of the large bowel. But haustral folds do not completely circle. Only valvulae conniventis completely circle. That's the point you need to differentiate. Good. So, Dr. Lahari versus Akhilesh. Let us see. Question number 35. A 14-year-old boy presented to the emergency with a 24-hour history. I know most of you will answer correctly. The pain localized to the right iliac fossa. Now, intraoperatively, the lesion is shown. Easy question. I don't think none of you will answer this wrong. Absolutely. So, doctor, it is a classical Meckel's diverticulum on the anti-mesenteric border is what you need to remember. Question number 36. A 72-year-old, please look into your smartphone, with 6-week history of lethargy, breathlessness. He is off the foot and has lost 20 kgs. So, looking at the CT scan, what is your diagnosis, doctor? Come on, punch your answers. Whoa! That is the cecal tumor, is what you should remember. Very good. So, doctors, Akhilesh, Lahari, Vishnu are very closely competing. Still, Akhilesh has got a good majority. अपने निकटतम प्रतिद्वंदी से 600 points आगे है. 70-year-old man complains intermittent sharp abdominal pain, 5 days constipation. What is your diagnosis? Please look into your smartphone to stretch your image. Yes, doctor. Coffee bean appearance or a bent inner tube, right? Sigmoid volvulus. Easy question. I'm sure all of you will answer this correctly. Not much of difference in the scores. 70-year-old man, 4-day history, colicky lower abdominal pain, vomiting for the past 2 days. Now, looking at the radiographic appearance, what is your diagnosis? Look into your smartphone, punch your answer. Whoa! I'm sure the top 6 rankers would have correctly answered. Yes. Oh no, Lahari, you missed it. But Indrajit is also coming quickly to fight with you. Sankeet also is up the ladder. Very good. Oh no, Faiz, Fatima, Gayatri, Vikram Thakur, Arvind, Basha, Anju. Very good. Thank you all players for joining this. Last 3 questions. A 66-year-old complaining of 5-day history of increasing left iliac fossa pain, barium enema. Come on, spotter diagnosis of this barium enema. Who is going to become the future radiologist, surgical gastroenterologist? Whoa! Very good. 11 of you are right. Diverticulosis, all those diverticulae you are able to see. Very good, Doctor. Akhilesh SP. Akhilesh SP. Let us see who is going to be the winner of 500 rupees cash prize. Very good. 69-year-old for the past 7 weeks has been passing more frequent stools, 3 to 4 times per day. Motions are looser than normal. Now, what is your diagnosis? Looking at the picture. Yes, doctor. Whoa. 8 of you are right. Apple core appearance. Apple core appearance. बहुत classical lesion होता है. Oh my God. Akhilesh is having बहुत बड़ा majority है. पूरा उत्तर प्रदेश का जनता का वोट मिल गया. So देखेंगे भैया क्या होगा. Last question to decide who is going to be the 500 rupees topper winner. ADPKD, what is false? ADPKD के बारे में wrong statement क्या है? Yes. Beautiful question. Bilateral cyst, small and multiple cyst leads to renal failure in the mid-adulthood because it is AD. Dominant है ना, adulthood में आता है. Recessive जो होता है, childhood में आता है. Oh my God, that brings us to the end of today's wonderful evening. And let us see. Whoa. The last question, Vishnu answered correctly. Akhilesh. Today's winner is Akhilesh, followed by SP, Vishnu, Lahari, Sankeet, Indrajit. Absolutely, doctor. मजा आ गया ना मुरली भरद्वाज के साथ चाय पे चर्चा. Bring all that excitation which is needed to become a topper doctor. Spardaya Vardhathey Vidya. Only when you fight, when you debate, when you challenge yourself. Otherwise, learning is very passive. Reading in the books, watching the videos, watching somebody's lecture. Oh my God, it's boring. But मुरली भरद्वाज के साथ रोज शाम मिलके एक लड़ाई करे तो पूरा देश के great minds like our SP, Vishnu, Sankeet, Faiz, Fatima, everybody, all our classmates will come every day evening. We will have fights, many more fights every day, and you keep winning 500 rupees cash prize by becoming the topper. So Akhilesh, congratulations. Please take a screenshot on your smartphone and send to our helpline 9000868356 and Paytm karo. You will get your cash prize. And good luck, guys. And don't forget, download Incus app. 999 rupees में आपको मिल जाएगा. Complete coaching program for 3 years. Hardly it is 1 rupee per day. Please spread this message to all your friends. And let's help many more number of people who are fighting the COVID on the streets. No point in making the coaching program costly. What for we are.